I'm Matthew, I'm a student physical. Hey, I failed! Hi, my name is Matthew. I'm a student physical therapist at Advent Health University, and today we're going to learn about respiration and pulse oximetry.
So what exactly is respiration? Respiration is the process of exchanging carbon dioxide with oxygen inside the lungs to provide oxygen throughout the body. In basic terms, it's how we breathe. The respiratory system consists of the nose, pharynx, and larynx, trachea, bronchi, and lungs. Before air reaches the lungs, it is split into right and left bronchi that enter the right and left lungs respectively. These bronchi continue to split until air reaches small sacs called alveoli, where gas exchange occurs. So why should a physical therapist check respiration? Poor respiration can be indicative of some physiological problems such as lung or chest damage. These problems can lead to low oxygen circulation throughout the body. Additionally, checking respiration can be used as a baseline measure for exertion if taken before, during, and after an activity. Before checking a patient's respiration, it's important to understand the factors that influence the way they breathe. These factors include age, body size and stature, exercise, body position, environment, emotions, and medications. Any one of these can be responsible for an increase or decrease in that person's respiration. As physical therapists, we use two measures to check a person's respiration. We use pulse oximetry or check respiration rate. First, let's see how a physical therapist checks pulse oximetry. The pulse oximeter is placed all the way on the patient's index finger and the button is pressed to initiate reading. As the instrument begins its reading, the patient should remain still. On this oximeter, a pulse reading can be read in beats per minute in the upper right corner. The larger number in the center records respiration in percent SpO2. This is a measurement of arterial blood supply, or what percent of hemoglobin in the blood is carrying oxygen. A percent SpO2 reading of less than 95% is considered significant, and supplemental oxygen should be considered. When documenting pulse oximetry, you can write pulse oximetry and the percent read by the oximeter. Additionally, the air transmission type can be recorded, especially in cases when patient receiving air by nasal cannula or ventilator. In this case, the pulse oximeter read 98% SpO2 and the patient was breathing room air. As a medical instrument, the pulse oximeter can be used in various locations. In addition to the finger, it can be placed on the toe, tongue, cheek, and earlobe. Precautions of this instrument include low cardiac output, vasoconstriction, and hypothermia. These conditions can either stop or change the pulse reading on the oximeter. In addition to pulse oximetry, a PT can measure respiration rate to analyze overall respiration. Let's see how this is done. The physical therapist tells the patient to place her right arm across her body. You will use this arm to help assist as a visual cue of rising chest height. You tell the patient you'll be checking their pulse, since you do not want them to know you're checking their breathing. Respiration patterns can change if the patient is conscious of their own breathing. The therapist counts the number of times the chest rises for 30 seconds. In addition to rate, depth can be recorded to signify the amount of air being exchanged in the lungs. Depth can be shallow or deep. Let's look at the difference. In this examination, the patient is exhibiting shallow breathing, showing minimal chest movement. Unlike shallow breathing, deep breathing shown by this patient shows greater chest rise and fall. Rhythm can also be recorded as a representation of breathing patterns. A regular rhythm has constant intervals between breaths and is consistent throughout. Irregular rhythm shows inconsistency in breathing patterns, as some breaths could be too close together while some are further apart. To document respiration rate, write the number of breaths taken in 30 seconds and times it by 2 in order to get the number of respirations per minute, written as RR. You will then document whether breathing was shallow or deep, and if the breathing pattern was regular or irregular.